The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hello, everyone. I'm super excited to have another guest this week. I have Dr. Samantha Ryan here. You may have seen her on TikTok. That's how we connected. Can you introduce yourself a little bit and tell us about your background in dentistry?
Yeah. Hi, everyone. My name is Samantha Ryan. I am a dentist, but my specialty is oral and maxillofacial radiology. I was born and raised in Sacramento, California. I went to UOP, Arthur A. Goni School of Dentistry in San Francisco. I actually did the accelerated pre-dental program. So I went there for undergrad, and that was 3 years. And then the dental school in San Francisco, 3 years as well. And then I did my radiology residency at University of Washington.
Nice. And then you got to land back at home in Sacramento. That's
Yes.
awesome.
Yeah, I did a brief stint in San Diego when my husband was finishing med school, but then we got to move back and I'm super happy to be home.
Oh, that's so cool. So there's so much I want to know about your path being a specialist and how you ended up there. But take me back to, doing the accelerated pre-dental into
Yeah.
dental school program, it's a lot and it's such an early age that you have to decide you want to be a dentist for one. Did you even know about the specialty at that point?
Did. I have a
Okay.
super unique path. So I was really fortunate. My dad's an oral surgeon. So that's how I got interested in the field of dentistry. I grew up in his office. I always knew I wanted to do that. Literally didn't even consider another career. But specialty, I was kind of open-minded. So in dental or in high school, actually, I had a club. I went to an all-girls high school and I had a club called the Dental Divas, which that could be the name because it was all girls. We were like pink, sparkly, everything. But I brought in speakers from all the different dental specialties to come and just introduce us to different fields because obviously we were so young, I didn't know anything. And one of my dad's actually longtime colleagues is an oral radiologist. His name is Dr. David Hatcher, and he's actually the one who started the company that I work for now, Beam Readers. And so, I learned a little bit about it from him, just like I was learning about all the other different dental specialties. And I just liked it. I liked the anatomy, the technology part of it. And so it was always just in the back of my mind when I went into dental school. I went in really open-minded. And so from there, kind of parsed it out amongst the different specialties. But radiology pulled me back in.
That's so cool. I feel like that's the one that I probably didn't know existed. And isn't technically anesthesia a specialty through dentistry?
Anesthesia is a specialty as
Yeah.
well. Yeah, there's a couple that are younger, just a couple dental specialties that are younger than radiology, which I think was founded early 2000s.
Okay, yeah. So they're still new-ish, but that's
Yes.
cool. Yeah. We use beam readers at my office all the time too. So when you mentioned that like that's where you work through, that's super cool. And to be connected with the guy that started beam readers. How cool. To me, I'm like, that's
I
like such a like legit company.
Yeah, I'm so fortunate because we actually at my school, UOP, from the whole 3 years I was there, we didn't have an oral radiologist, which is kind of crazy looking back. It was just a general dentist teaching us radiology, obviously. But yeah, I don't think I ever would have been exposed to it until probably way after school if it wasn't for him. So I was really fortunate. But yeah, I encourage everyone to go into dental school very open-minded because I'm sure you feel the same way. You don't really know anything about a specialty until you're able to really get in there and shadow and get to know people and ask them questions and stuff. There's just such a difference between what you think that it might be like and then what it's actually like. So, yeah, I definitely enjoyed different things than I thought I would.
Yeah, we had, in my opinion, really great radiology faculty that were specialists. I feel like they go and like speak on panels and they're like viewed as knowledgeable in the field, which is
Nice.
cool.
That's awesome.
Yeah, and I got to do like a extra elective CT reading course, which we barely get
Cool.
any CTs in our normal pathology classes and stuff too. So
Right.
I felt like at Michigan they gave us like if someone was actually interested in radiology, that might be a good
Yeah.
place to go if you want actual hands-on opportunities.
Yeah, that's really good to hear. I mean, every school is different, and I know at UW where I went to residency, it was such a different ball game because having a radiology residency there, it was like as residents, we were in there teaching the dental students in clinic. There was just a lot more access, I think, to information about it because the specialty was there. So yeah, it's definitely different.
I want to know more about residency. What was that like? How long is it? What does it kind of look like curriculum wise?
Yeah, it's 2 to 3 years depending on where you go. When I applied, there was I think about 10 programs in the United States and then a couple in Canada. So there's not a lot of programs. You might think that it's less competitive because it definitely is a smaller specialty, less people applying, but due to the limited number of spots, I mean, most programs only take 2 to 4 residents per class. So it's actually not a lot of spots. So it was pretty competitive by the time that I was applying. And I know it's more competitive now. So it's actually kind of crazy. But the curriculum, I went to a 2 year school. The difference between the 2 and 3 years, a lot of times, is whether or not you get a master's degree. So I knew I was probably going to do primarily private practice. I still enjoy teaching a little bit, but I wasn't dead set on having the master's. So I wanted to do the 2 year school, mostly because they'll pay you as well. Like we got paid just like the medical residents there, which was a nice bonus. So yeah, the 2 year curriculum was you kind of start general classes. We started with a lot of the other residency programs. So we were in with perio, prost, ortho, peds, and we were all taking biostats, another head and neck anatomy course, really in depth, cadaver lab, that kind of stuff. And then you kind of break off more. And most of the time is spent with your radiology faculty and residents. So you're in teaching the dental students in clinic. You do rotations through a lot of the other specialties, including some of the medical specialties. So we took physics with the medical physics residents. We did 4 months in neuroradiology, in their reading service, stuff like that. So yeah, all kinds of cool stuff.
That's awesome. And then in my mind, I'm like, that literally sounds so hard and like not for me. So good for you for doing that.
You know what is not, I don't want to say it's not hard because obviously everything is challenging in different ways, but it's a very different type of hard than dental school. Because dental school, you're having these constant assessments, tests. It's like that water coming out of the fire hose type analogy with all of the information. And in residency, at least for us, there's really no more assessments. Like there's no tests in a typical graded sense. It's more of just a continuous learning. So there's a lot of material coming out at you, and you're constantly doing literature reviews, peer cases, obviously learning to read. I mean, we read every single 2D radiograph that came through the dental clinic. Either we read it or we taught a dental student how to read that image. And then obviously learning how to read CBCT, which is like 99% of what we do. So it's a lot, but it's more like hands-on orally being taught rather than that typical graded test vibe, which I think actually for me was a little bit challenging. I didn't expect it to be challenging, but I think when you come from a place of being able to get validation through an exam and you get an A+, you nailed that material, very different to switch gears to something that's a little bit more subjective.
Yeah, absolutely. And at the end of it, did you have like a graduation from the program and then on your own terms you had to take some kind of boards, or is it usually most people do it before graduating the program?
Yeah, so we do. There is a board exam. You actually have to have been in residency for 2 years before challenging part one of the board. So if you're in a 2 year program, you have to wait until you're graduated. If it's a 3 year program, you could take part one, and then you actually have to wait a whole year after passing part one to take part two.
Wow, that's a whole process. So in that
Yeah.
time of you did residency, what could you do employment wise when you finished your residency as you were kind of going through your board?
So you actually don't have to be board certified to practice. There's some specialties where you do have to be, but for radiology, because it's a newer specialty, it's not, you don't have to be board certified to practice. So it's obviously a nice feather in your cap. There's actually this kind of goes into one of the questions I know you wanted to ask about in terms of challenges that arise. But there is an kind of issue that happened with the board while I was challenging part one, where we never got our scores to our exam because of things kind of out of our control in terms of the hierarchy and academia and all that stuff. So I'm technically still not board certified because they haven't offered that exam again. So we're waiting for them to do that. But yeah, it is definitely not ideal.
Yeah, but it's you're ready. You want to do it.
Yeah, definitely. But yeah, all of that to say you don't have to be board certified to practice. It's more of like a feather in your cap to say, I did this, but it's just graduating from an accredited program that lets you be a radiologist.
Yeah, and then that gives you the skill set to do it and do it well so that you're practicing safely and everything. And I think you mentioned a little bit when we talked over TikTok that you have worked like general dentist shifts as well. When did you do that? How did you do that? Why did you do that?
Yeah, so I didn't practice general dentistry right out of dental school. I went right into residency, and it was really because I knew what I wanted to do. I was like I kind of mentioned, I came into dental school open-minded, thought about almost every single specialty, really just continued to love oral anatomy, pathology, radiology, the technology behind it. It's like a puzzle, and being able to support the dentist, like the dentists are your clients. But I never disliked general dentistry, which I think is a really big difference compared to some of my radiology colleagues don't like, some parts of clinical dentistry, which is totally, fair. Everybody has their things that they like and dislike. But I applied to residency right out of dental school. I was really fortunate, that I got in. If I hadn't gotten in, my plan B would have been to practice for a year, reapply. But I got into a great program and was able to, go forth. But I, never got to scratch that itch of using all of the stuff that we learn in dental school. And I had a professor in residency who really inspired me. He's a great radiologist, but he worked one day of general dentistry his entire career. And he always said that it kept him thinking like a general dentist. Because, like I said, as a radiologist, the general dentist is your client. So to be able to think like them and be problem solving like them and think about, okay, what information do they need to know to actually do the procedure, to serve this patient? I was really inspired by that. And so after a little bit, I practiced radiology for about a year. And then once we landed back in Sacramento, I knew I was going to be, in one place for a long time. I started kind of looking for the right job. I knew it was going to be, I was a little nervous because I'm essentially, a new grad in terms of general dentistry, but I was so fortunate to find the practice that I work at. They're just all about patient care, mentorship, and I feel super comfortable there. So I've been doing that for about a year now.
And are you doing that once a week or like less often, like a couple times a month?
I'm actually doing it 2 days a week right now.
Wow. Okay.
Yeah. So as I'm, ramping up my radiology and everything, I felt like to be fair, part of it is my husband is in the first year of his residency. So he's busy all the time. So I'm like, you know what, let's just get after it. Let's grind right now. We don't have any kids. So I feel like it's the beginning of my career and I'm probably the most energetic I'll ever be. So it's been super fun and I love it so far.
Yeah, and I mean, it also doesn't help to hurt to make more money either when we've got loans and
Totally. Yeah.
everything. So
Yeah.
very cool. There's something I realized after dental school. They don't teach you everything, like how to manage debt and build wealth, the top 10 mistakes to avoid, or whether it makes more sense to build, buy, or become an associate first. Here's the good news. ADEC and Ignite DDS are hosting a free event called New Dentist Day of Experts that tackles these real-world questions. You'll spend a day learning from experienced professionals who offer real-world guidance and wrap it all up with a happy hour where you can connect with other dental students facing the same post-grad decisions as you. And even better, ADEC will cover one night of accommodations, food, drinks, and admission. Just mark your calendar for July 18th in Nashville, Tennessee, and head to the link in my show notes to register. New Dentist Day of Experts. Learn what they don't teach you in dental school. You don't want to miss this. Head over to the link right now. Tell me a little bit about, because I said I'm familiar with beam readers, but what is what you do when you're not doing the general dentistry? What company are you working
Yes.
for? How does it work between the general dentist and you?
Yes, I love that question because I feel like there's a lot of confusion around oral radiology, just from all different aspects in terms of knowing that it's a specialty, knowing that oral radiologists exist, and knowing how you as a general dentist or a specialist can work with us or how we can be part of your teams. We basically read CBCTs for the most part. We also can read 2D x-rays. So occasionally we'll get a pan that has a weird question or a, PA or bite wing or something. We can also read TMJ MRIs. That's less common because as a general dentist, you're obviously going to have less access to that stuff if you do have that imaging. But the bulk of what we do is CBCT. So you as a, general dentist, if you have a CBCT machine in your office, you take a scan. It's up to you whether to decide if you want to have that read by a radiologist or if you want to read it yourself. Either way, the image needs to be read. So that's the number one thing that I tell people that I feel like isn't usually really clearly discussed in dental school is the legal ramifications of CBCT. So every single radiograph that we're taking, you are, responsible for reviewing every single piece of anatomy in that image. So I've heard about some dental offices having patients sign something that gets them out of, this is not going to be the consent to have something not read medically or something like that. None of that stuff holds up in court. So it's really you as the dentist, if you are the highest level of provider taking care of that patient, you're in charge of reading that image. So it's up to you if you're comfortable with the patient, specifically with the area of interest, because CBCT can be a really small field of view. It can also be a larger field of view. It's up to you as a clinician to decide if you feel comfortable reading that image. If you do, great. You get, you read it, you write your note or your report. If you don't, you can send it to a radiologist to be read. Or if you see something weird in the image and you just want a second opinion, you can send it to a radiologist to be read. So I work for Beam Readers, which is one of the largest radiology companies. And basically how it works is you or your practice would create an account with us. And then if you have a specific radiologist that you want to, read your case, you can request that. Or if not, it'll just get sent to somebody randomly, but you're able to just upload the DICOM, which is the file, or there is a few different file types, but DICOM is usually the basic one. And you're able to upload that to a server. And then within 3 to 5 business days, you will get a report from the radiologist stating all of their findings, their assessment of everything that they found in that image, and then answering any specific questions that you have. So if you have a question about how close is this tooth to the inferior alveolar canal, or, there's something weird in the sinus, can you look at that? Do you think there's a root fracture on number 18? Whatever questions you have, you can put in there and then basically get answered.
Yeah, and exactly what you said. And they did emphasize that to us at school is if you're going to take an image, you are responsible. Like maybe you want to look if there is a radiolucency on 14, but if you're taking the full field of view,
right,
sinuses to end of the jaw, like you have to check every single piece of it. So I mean, it'd probably be in your best interest to get them all read by radiologists. We personally, and I send them when I'm exactly like you said, I have something I'm like, that's a little weird. Maybe even if I think I have good differentials and I know what I want to do, but I just want that extra support. Or I've had times where I know I was going to refer the patient to oral surgery anyways to get it evaluated and maybe biopsied or whatever it may be. But it's easier for them to have the nice radiology report to like look at everything labeled and seeing those differentials on there. It's easier for them to understand, I think, than what I can like communicate sometimes. So that's been other times that I've chose to send things off and kind of collaborate. And it's been really great.
Yeah, it's a great tool too, a platform like Beam Readers to be able to share your case with other people too, because you don't have to deal with any of the, how do I send this file to somebody else? You can literally just add them onto your area of that case and they can see everything that you can see. So that's really nice. And my dad is a great example of an oral surgeon, actually, who he's an MD DDS. He's been practicing for forever. And he sends scans to be read by a radiologist all the time because there's no harm in doing it. And it's something that a lot of times it costs around $100 for one scan, give or take. And it's something that he charges the patient for. He says, this is a necessary radiograph to treat you. And it's going to be read by an oral maxillofacial radiologist that's going to, assist with the case. And he doesn't receive any pushback from patients in that regard because it's really it's a great tool as well to be able to show your patients, hey, this is an expert in this area that's going to be looking at this. Oftentimes they appreciate that.
And on your end as working there, what does it look like because for us, I didn't know anyone specific on the inside. So I just send it and it gets interpreted by whatever radiologist. So are you just like logged on for the day and things pop up and you just click through and work? Like how does your day-to-day look?
Yeah, so you're as a radiologist, you're an independent contractor. At least I am for beam readers, and oftentimes that is what it is. So you either have people who are requesting you, people that you know. I personally love getting to write reports for people that I know, connections that I form in the professional world, because it allows me to do a better job, right? If I know you, if I know your practice style, if I know what's important to you, I can totally curate my report to be exactly what you want to be answering your question. So I would much prefer that. But yeah, the alternative is you'll just be paired up with random practices that are submitting cases. And it's not as a, being an independent contractor, it's not time based, it's work based. So you're getting paid per case that you do. And that's where some of the flexibility and the nice lifestyle parts about being a radiologist comes in, because it's not, you can work on your own schedule. You can do cases at your own pace and your own time, as long as you're getting them to the clinician in that right amount of time.
That's awesome. And I'm sure that's part of why it's getting more competitive because I feel like COVID made everyone see like family and partners get to work from home
Yeah,
and
all
they're
of a
like,
sudden
I'm a
everybody can
dentist.
work from
Yeah.
home and you can't do that.
Yeah. So I feel like I have to imagine more people were looking for non chairside clinical dental options. So I'm sure it's
Yeah.
way more competitive. Even like that was when you were applying too, but then it maybe was
Yeah.
10 years ago.
Yeah, I think so. There's pros and cons to every job, I feel. And I've even felt that as, doing my general dentistry job, there is a pro to being able to leave and go to your place of work and have coworkers and all this stuff. I mean, radiology I love it because I'm secretly an introvert. So I really like being able to dive deep, and it's like every single case is kind of like a little puzzle. So I get to like serve my clinician. I'm looking at this little puzzle, but if you're an extreme extrovert, I probably would not recommend the field for you, because you're most of the time not talking to anybody. Day to day, you're literally sitting in front of your computer going through your cases, and you're only talking to people. Maybe if you need to discuss a case with the clinician, or if you need to call upon one of your colleagues, to discuss something, that's the nice part about beam readers and working within a company that has so many other radiologists. We do this thing called escalations. We can just send a case to each other, and it just like zips over in their inbox, and you can get, multiple people's opinions. So that is the nice part, about being a part of a larger team. But yeah, it could definitely be isolating if you don't have the personality for it.
And I'm curious if you're open to talking about the relationship with your husband, him being med school and then residency while you were doing dental school residency working. What was that dynamic life like? And do you have any advice for people that are also like two professionals trying to navigate all of that?
I have so much advice about this topic. So we actually met in high school, and we did 8 years of long distance through college, dental school, medical school, and my residency. And part of that was super long distance across the country, because I went to UOP undergrad, which is in Stockton, California, if you know where that is. And his undergrad was Georgetown in Washington, D.C. So it was like as far apart as you can get. And we did, that. And then med school, dental school is a little bit closer, but it's really all about communication. We never went a day without talking to each other. And as much as it wasn't fun, like I don't want to go back to it. It was 100% worth it if it's the person that you want to spend the rest of your life with. If it wasn't, I wouldn't have done it. Definitely not worth it. But if at the end of the day, if it's the right person, it's not as hard as you think it would be. That makes sense.
And when were you guys able to get married?
We got engaged while I was in dental school, and we wanted to wait to get married till we were actually able to live together. So we got married just this past year. It's about a year. It's coming up on a year now.
Oh, congrats. So
Thank
exciting. I'm
you.
sure everyone at the wedding was like, finally.
Yeah, there's so many people who have known us for our whole lives, so it was kind of crazy because our families had known each other for forever. So it didn't really feel like a meeting or a union of families, because they already kind of are, but it was definitely a big celebration.
What else do you have to share about going from dental school to residency to now like working full adult life, no more like student life? What has the transition been like for you?
Ooh, that's a good question. It makes me reflect differently on my time in dental school. I think when you're, at least if you're like me, who, I went straight into this accelerated pre-dental program, straight into dental school, you're so in student mode and you're geared towards that one next step, right? I got to get the grades to get into dental school. I got to get the grades to get into residency. XYZ. It's like there's always that right next step. But in life, there isn't always that direct next step, right? And like I was talking about that situation with our radiology board, that was something that was kind of completely out of my control, completely out of the control of all the candidates. And it was a bummer, right? Like essentially we studied for several months, dedicated, and then we just never got to find out, if we passed or not, and are kind of left hanging in limbo, obviously while we work, which is amazing. But, it's just this kind of loophole that we never expected. And I think when you're going through school, you never really think of being thrown a curveball like that. And it makes me reflect differently on my time in dental school because, going from that XYZ, doing something to get the grade, it's not really about doing something to get the grade. It's doing something so that you're going to be able to be a confident, competent, excellent clinician once you get out. And those are really just skills that compound. So I think back to in dental school, I had a really great friend, a roommate for 3 years, and she was 6 years older than me. And that was kind of, to me, it was like, how are we, in the same place? And she just had all of this other life experience that she had being a bartender, being a waitress, all these kind of odd jobs and stuff that led her to the field of dentistry. And I realized that all of those things made her a better clinician. And I feel like I'm kind of catching up on all that life experience now. So it's really just the idea that it's not about, the destination. It really is about the journey. And every single part of your individual journey is going to help you be, the clinician that you want to be at the end of the day.
Yeah, and I had another recent residency graduate on the podcast a couple weeks ago that is an endodontist, and she was sharing that she, coming out of residency, had a lot of that like imposter syndrome that a lot of people deal with, that it's just like such a weird adjustment to being like, I finally got like to the thing that like I spent forever working towards, and it's like, now I'm here, like now what? And I feel like it's really easy for whatever stage of life you're in to just always be looking for what's next. Once I get there, then I'm going to really be present and really soak in life. But I think it's so important to enjoy where you're at and make the most of each stage too, like you were saying.
Yes. I think my husband has actually done a much better job at that than I have. He has this motto, and it's that you have to enjoy life as you're enjoying your training, which makes sense for someone like him because he's doing anesthesiology. So it's a very, it's a long career path. You have to kind of enjoy it as you're going through. But it's kind of funny because I did not have that mindset. I had the mindset of, I'm going to buckle down, I'm going to get through XYZ, and then I'm going to pop out and enjoy my life, right? And I just wish that I think I learned along the way that that's not really, really realistic. And I was always pretty balanced, but that's really not the way to do it. You are able to be balanced and be able to be in school and have a life outside of that. And I think it does make you better for it.
What other advice would you tell people for having that balance now that they're out of school or out of residency and in the real work life?
In regards to imposter syndrome, I think it's to accept it a little bit. I definitely suffer from that, just being a younger person who's practicing a specialty. But I think the idea that we think of ourselves as, not as competent as the person next to it just because it's us is actually, if you can rewire your brain a little bit, a good thing, because we constantly should be seeking to improve, our skills, our means of communication, the, care that we're giving people. We want to be constantly improving those things. So if you are thinking about that, it's actually a really good sign that you're, cognizant of your limitations, because we all have them, but also to give yourself a little bit of grace. Because if you did that training, you need to have that in your back pocket and rely on that and trust that you wouldn't be here if you weren't the person for the job.
Very cool. And I have to ask about it because I saw on your Instagram. So your time doing like Miss USA for your state and all of that competitions and stuff. Tell me about that. How did that fit in? It seems like you were so busy. How did you manage to do all of that?
Yeah, so as I was Miss Washington USA and I did get to go compete at Miss USA. It was kind of something that was not ever meant to be part of my path. When I was in high school, I was exposed to really small local pageant because I had a friend who did it and she kind of encouraged me to do it. Totally outside of my wheelhouse. I was always a nerd and she taught me how to walk in high heels and all that stuff. And I ended up winning. And it was really just like the best experience. It was, you do all these cool community service projects in your area with these other girls, and I really enjoyed it. I made great friends, but I knew going through college dental school I didn't really have time for any of that stuff. But when I was in dental school, I learned that there had never been a dentist or a doctor compete at Miss USA, which was kind of like the premier pageant at the time. And I just thought, I was like, how cool would that be to be able to show other young women that no, just because you know, are, accomplishing things in the academic or professional world, that you can't do something else. And so I kind of thought, okay, maybe I'll give it a try. And in my first year of residency, I just entered the Washington USA competition. I ended up winning. And it was really a life-changing experience for me because I got to kind of live that idea of, if you can see her, you can be her. So just that there had never been somebody to do that before, and to get to do it, it was, I felt like I got to, live amongst my role models in that regard. And it was, yeah, one of the best experiences of my life for sure.
That is so beautiful and so cool. Good for you. I
Thank
mean,
you.
that's awesome. I'm sure so many people were inspired through your time of that. And it's just something so special to be able to look on your life and be like, yeah, like I did that.
Yeah, it's also something to be said though, that nobody really knows. I don't know, a lot of times only we know what we went through to get to somewhere. And in regards to pageants, there's a ton of misconceptions about them. And I actually had some instances of people within my residency program maybe mischaracterizing me or not really understanding, thinking that it's a beauty competition, which is really not anymore. If you learn about it, it's really highlighting women and all the cool things that they're doing in all of these different areas. And I met so many incredible, intelligent, driven women, and it just isn't what people kind of boil it down to oftentimes. So it really has made me look upon everything in my life and interactions with other people and just be way more open-minded about things, and to not have a preconceived notion going in, to really be able to hear people out about their lives and what they've experienced.
And was that a time during residency and going through that competition series when you were being more active on social media, or when did you start to tie in your dental world with social media?
I was being, that was my first kind of introduction to social media, because it was kind of a duty as a title holder. You had to post a certain amount of times on the Instagram page and all these things. So which I was not used to doing. So I kind of learned social media a little bit through that, but I wasn't really sharing a lot of my dental journey. I was sharing a little smidgen. My kind of platform that I chose to promote, I called Girl Docs Rock. And so I interviewed women much like you, kind of about what they were doing in their field and how they got there and stuff like that. So that was my kind of the first way that I started dipping my toes into the water of, the dental world online. And I really loved it. I loved how I got to meet and interact with women like you, where we would have probably never met, out in the real world, but now we get to meet and be friends and support each other. And so, yeah, I definitely gained that as well through that experience.
Very cool. Well, thank you so much. I've absolutely loved getting to talk to you today. We were hinting a little bit that I found you on TikTok, but where can people find you if they want to follow along or if they have any questions for you?
Yeah, my Instagram, TikTok handle for everything is at Dr. Samantha Ryan, spelled the way that it sounds. And yeah, thank you so much for having me. I am always super, super happy to chat with people if they have a question about radiology or CBCT or even getting to dental school. I always like to encourage that it's not as hard as you think it's going to be. And there's a lot of people out there that try to tell you that it's going to be hard, and it is going to be hard, but it's not going to be impossible. So yeah, just the notion to believe in yourself and that you can absolutely do it if it's what you're passionate about.
I love that message. Thank you for ending on an inspiring note, and thank you so much for all your time.
Yeah, thanks.